Welcome back. As you know, May's Mental Health Awareness Month, and today we got Sheri Moore. She's the Executive Director of NAMI West Central, Indiana, and we appreciate you joining us today.
Thanks so much for having us.
Yeah, we really appreciate it. Thank you. All right. Well, a big effort by you guys right now is, reducing the stigma, breaking the silence, right? So can you talk about why that's important, why we need to end the silence when it comes to talking about mental health?
Right, so if we look at youth, we know that anxiety and depression and suicidal ideation has skyrocketed since COVID. So we also know that all mental health symptoms start by the age of, or 50% of all mental health symptoms start by the age of 14. So we have developed a program, the national organization has developed a program called Ending the Silence. So we go in and do a presentation in schools for middle school, high school students, teachers, parents, and actually the community to educate kids about mental health, things like that.
Okay, that's great. So
yeah.
Go ahead.
We also know that in young adults that 75% of all mental health symptoms start by the age of 24. So through the Arconic Foundation, we have been awarded a grant to develop another program to educate that age group more specifically about mental illness and how to recognize it within themselves or in others and how to ask for help.
That's great. So you guys, have these programs to really get boots on the ground in these places, it sounds like. And you mentioned, a percentage of seeing issues by the time you're 14, by the time you're 24. Would you say, is it young people and young adults that are maybe more at risk of having these mental health issues? Who's the most at risk?
Certainly, today everybody's at risk, but we know these are starting early in young adults or young youth and young adults. Something interesting is, on the average, it takes 11 years from the onset of symptoms before someone gets into services or into treatment. Now, if you had diabetes and let that go for 11 years, what would that do?
It'd be bad.
It would be bad. And same thing for mental health. We need to be able to take care of our mental health and seek treatment, seek support, and that's what we do. We provide peer-led support for adults. We have a drop-in center where people can come in. We have social activities to eliminate isolation and loneliness. So people can just drop in, attend a group, be surrounded by peer support.
Okay, great. So what do people need to look out for? What are the red flags, would you say, the symptoms that says, hey, I need to go get help now and not wait, so many years like you said? Yeah,
so, people, anxiety, worrying about things. We all worry about things, but this is excessive and paralyzing for people to continually worry about things. Depression, same thing. We all get sad and depressed, but this is when it overtakes where you can't get out and go to school or go to work. So when people are change of behavior, what they once enjoyed, they're not enjoying now. That's those are red flags to look for.
So, and you guys, you talked about some of the programs that you guys offer to people and how you meet people where they are. If you're noticing maybe it's not yourself, but it's someone you love, it's a family member or friend, how do you connect? How do you talk to them about this difficult, conversation and then help them get connected to services? Right.
So, caregiving, parents, loved ones who care for people with the mental health conditions don't maybe always understand what is all going on. So we provide family support groups for family members, loved ones. We provide educational classes which are life-changing, understanding how to navigate through our mental health system. So, just getting the support, asking the questions, and just, finding the solutions.
All right, absolutely. Great advice there. Again, this is Sheri Moore with NAMI West Central Indiana. Greatly appreciate you having coming out here for our series on Mental Health Awareness Month. Greatly appreciate you coming out. Thanks
so much.
All right, thanks again, Sheri. And